Welcome to the D&D Fitness Radio podcast, brought to you by your hosts, Don Saladino from New York City and Derek Hansen from Vancouver, Canada.
This is awesome because Derek and I have had discussions about concussions, but you really are someone. I mean, how do you explain what it is you do? I'm not calling you a concussion expert, but you kind of are, aren't you?
That's the title people tend to give me. Yeah.
Right.
So, I mean, I'm a physical therapist who has basically focused my career and around concussion education in the brain and all that stuff. So, yeah.
And how did you get into this?
Super randomly, actually. I actually legit just did a post this morning on my social about it, to be honest. So I've been a neurological physical therapist for 10 years. And the reason I got into that was because my cousin was in a motorcycle accident and became a quadriplegic. And the people that he raved about on his kind of rehab were his therapists, not the doctors, not the neurologists, the physios. So that kind of started me down that path. And then I graduated physio school, blah, 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 blah. We moved to Nanaimo. And when we moved here, I was on maternity leave with my son. We transferred because of my husband's work, and there was nowhere for me to work. As in, I shouldn't say that there was no physical therapy clinics that treated the neurological population. So at that point in time, I was working with strokes and spinal cord and Parkinson's and MS and ALS and all those types of neurological diagnoses. And it just so happened that there was an occupational therapist in town that had this client who, and this was probably about 5 years ago now, had a client who had a concussion and wasn't getting better, and no one knew what to do. And so her response was kind of like, well, Natasha's the brain person. Let's refer her to the neurophysio. And so she referred me this client, and it was my first ever concussion client. I had no idea what the frick to do because treating a stroke is not the same as treating a concussion. And I kind of had to dig back into my archives of where my knowledge was, what did I knew the brain did, how did I knew things worked, started to kind of do my own research, and then immediately started diving down the rabbit hole of concussion in the brain, and it's just continued ever since.
It's funny, and sorry about that. Now that we're, living in this environment, there are dogs in the background where I'd normally be in a podcast room. But could you talk to everyone right now a little bit? We all know what concussions are, but what's really, and everyone, well, someone took a big hit, it's like, all right, well, what's actually happening in the brain to where it causes this type of trauma?
Yeah. So I think concussion itself, so I want to squash some old myths, because when you Google a couple things, it still says, you've lost consciousness or you hit your head, which is you couldn't be farther from the truth at this point. So we know that you don't need to hit your head to have a concussion. We know that you don't need to lose consciousness to have a concussion. So a concussion is really a biomechanical force that causes an acceleration, deceleration injury of the brain that causes shearing within the brain itself. And so it causes structural issues, microstructural, metabolic issues, inflammation, and all these different things. So what happens in this acute phase, so there's acute concussion, which is what most people think of. And most people also think that'll just disappear in a few days or a couple weeks. And then we have persistent. So different things happening in both those places.
So explain to us so you were talking about some of the myths of what we think has to happen to allow a concussion to take place. So you have to lose consciousness, et cetera. But are those myths?
Those are myths, hugely. So, that's what we used to think. That's the old science. And so we now know that you don't need to hit your head to have a concussion. You don't need to lose consciousness. And I think I always vary the stat, but it's between 5 to 10% of people who have a concussion lose consciousness. So there's a huge percentage that don't, right? So what a concussion itself actually is it's the acceleration, deceleration injury. It causes shearing and twisting of the axons within the brain. And so there's a researcher Letty does a ton of research in concussion. And I love his synopsis, which is just it's a metabolic, physiological, a microstructural injury to the brain. And then it goes through this whole, of which we can go through it if you want, but there's this whole pathological process that actually happens within this brain in this acute phase of concussion. Unfortunately, you don't see it on CT scans. You don't see it on MRIs. So it's a functional injury. Nothing pathological shows up on imaging, which is unfortunately how a lot of physicians and doctors they use those to help you diagnose things, right? So
a doctor just has to diagnose it based off of their knowledge.
yeah, so it's based off of symptom presentation. It's based off of different signs. There's different objective testing we can do now that we know a concussion example will affect eye movement. So we're going to do saccadic eye testing. We know it can affect balance, but there really is, it's a concussion diagnosis at this point is really based off of knowing the mechanism of what happened and then signs and symptoms that the client presents of which we know can encompass what a concussion is.
Deep.
I was just asking Dawn, have you ever been concussed? At least
I have. I have actually several times growing up, at least to where I was diagnosed. But, you know, I'm 43. So at what ages was I getting concussed? I got concussed probably between the ages of 13 and 23. Oh God, I mean, a slalom skiing accident. I was really into slalom skiing. A ski broke on my head, and they had to pull me out of the water. I tried a 720 snowboarding, and I woke up in the snow. That was 2. I had a Heineken bottle broke over my head at a bar one night. That was 3. And there's probably some more in there that I would imagine. So, you know, I don't know. Like, do I worry about it? No, I don't worry about it. It is what it is at this point. You know, I can't go back and change. There's probably 1 or 2 more in there. So yeah, I probably had 4 or 5, I would say.
Well, and you know, like the majority of people who get concussions, 70% of people, 80% of people recover just fine.
Yeah.
Right? It's that there's 30% more that go on to this persistent world of concussion. And that's the world of concussion that I think people don't really ever know about. And that acute phase, so like all this stuff you talk about, like, and back when you were 13, it was probably like go rest in a dark room for a few days and then go back to life.
Yeah, it's like go home and take a nap. It's like you're done. Like we didn't really like care about it back then. It was up until what, about a decade ago? When did this become? When do you feel like people started talking about this a little bit more? I feel like it was recent.
It was, I would say, within the last 5 years. It was truly like, I think like the kickoff was Will Smith movie Concussion. It put it in the forefront of people's living rooms, right? Because they related CTE and concussion to football, and it was a big movie that came out. And I think that was probably one of the big shifts in that. And then since then, it's just continued to roll.
Right. And Derek, we had a couple athletes that announced like career, like retiring concussions. And I think that really kind of shook people up a little bit. Like, whoa, like this guy's, who is it? Andrew Luck was one of them, right?
Or the guys who basically killed themselves and shot themselves in the chest so that they could look at their brain. Like Junior Seau.
Yeah.
So
that was sad. I remember that. That was a while ago. I remember that though, like it was yesterday. That was
being
scary.
Canadian too, you have Sid Crosby, who was out for however long from hockey with his concussion too, right? So
Eric
anytime I have a Google alert set on my phone. So every day I get these emails about all the new like popular media concussion stuff. And you open it now, and it's like, this athlete's gone for concussion protocol. This person's announcing retirement. This person's entering concussion protocol. You're seeing it every single day now. And then difference is like we talked about before, acute management was go rest in a dark room, you'll be fine. That is not the management on how you manage an acute concussion anymore at all. Like it's not the way it rolls. And the issue is that this knowledge and this education of what do you do when you get that diagnosis, that's still something people are learning. And if we can do that, the research shows us too, if we manage it properly, which we can talk about that in a second, but if you manage it properly in that acute phase, your chance of recovery is like a faster recovery is better, but also a decreased chance of potentially developing those persistent symptoms down the road. Because we don't really know what drives those persistent symptoms for happening for some people.
How much variability is there between individuals? Because you see, like I said, the Eric Lindros, where, you know, he had to stop his career and he just seemed more susceptible. And then you have people who are fighters, boxers, who, you know, obviously clearly slurring their speech. And then you have George Foreman, you know, advertising his grill, and he seems fine. And, you know, he took quite a few shots to the head as well. And, you know, I'm just wondering what variability you've seen between individuals.
Tons. Like there is legitimately that saying of no two concussions are alike. It couldn't be more true, right? It's when you look at how someone responds to a concussion or why they recover. I mean, you obviously are looking at the severity of the mechanism. You're looking at how they're going through recovery in the process, but you're also looking, I think a big piece of it is how is that person's health and function before the concussion as well, right? So if someone was already having neurological issues or had memory issues or just wasn't a healthy individual, they're probably not going to do as well as someone who is constantly, strong and healthy and active and making good decisions and nutrition and all those things. That person technically should do better. But we don't, same thing, and we don't really know why. They used to think that if you lost consciousness, it was going to be worse than this. But the mechanisms that we see of people who, when they describe how they got their concussion, compared to some of the concussions I see, you would think person number B would be persistent, when really that's the person who was able to bounce back and we could rehab them super awesome. And their objective findings are all on point. And the person who had what you would think would be, okay, rest for a few days and go back, are entering into this persistent stage of rehab. So there's the research is starting to look at what are some outcomes we can see that we know will prolong recovery. And so then there's certain eye things we see, and headaches is a really biggie and fatigue is a big one. But to look at two people and say, you would do better if you had a concussion or not, like, we just don't know.
Right. And what are like specific protocols? So if you have an athlete that comes in, and I'm not saying you work with Sid Crosby, I know that's completely, that's confidential, but let's say it is a hockey player that comes into you and, they have a concussion, a couple months later, they come back and they get their bell rung again. And now the organization is like, all right, we're really concerned about this. Is there, but besides rest, is there a specific protocol? And this might sound like stupid, like, yeah, of course, I bet like light exercise, a proper diet, maybe more omegas. Like, is there something that you guys recommend to, I think, reduce the risk of,
Yes. Yeah.
I actually got a good story before you start, because I want you to comment on this. I worked in a university and had a football program, and they did testing. And so they would do cognitive testing, like, okay, we want you to name all of the months from September backwards, right? And so these are football players, right? So they're like, they don't even know, like, in the pre-testing. But then every time they do it again, they got better, even though they got a concussion. So that would kind of skew the results. What do you say about that as part of what Don's saying, like the assessment?
Yeah, so you're looking at like a baseline test. And so they're still recommended in the sense that, but there's things, so there's a bunch of different ones, right? So impact is one that was developed in the US that's a very known one. I use a system called EQ Brain Performance. There's a whole bunch of other ones out there too. In BC, there's one called Head Check. And the thought behind a baseline test is it gives you this cognitive baseline that if they were to get concussed, you have something to compare someone to help in that return to play decision. So those baseline tests don't help to diagnose the concussion, but they're meant to help that return to play. What some of the studies look at is there a learned or performance with doing it over time? And then mixed results on that one. And then there's other studies like, well, our athlete's not going to try as hard in the baseline test. So that way, when they get compared, they are being compared to a lower score. And so honestly, you're going to find and read studies that support and disprove both of those things. I use this system. So pre-injury, my baseline test involves a little bit more than the things that the athlete could skew their own performance, for example. So I do use a system called EQ Brain Performance. So it does do that, like, here's your memory test, here's your delayed memory, here's a version of, they call it a rapid eye movement test. If you're familiar with the King-Devick test, it's kind of the same idea. It's eye movement across the screen. It looks at balance. It looks at a little bit of cognitive stuff. But then I will also do an ocular motor movement assessment. So I use a system that's an infrared camera that you will follow a target on the screen, and the computer generates this graph for me on how your eyes do normally, because we know that particularly saccades can be affected with concussion. So I have a baseline of ocular motor eye movement. I also put clients in what I call infrared goggles, and these goggles let me see their eyes in the dark. And so when their eyes are in the dark, it gives me a really good understanding of their vestibular system, of their perception of space, And there's involuntary movements our eyes can have when different parts of our brain just aren't on point, that they can't fake those movements. So I have that as a baseline as well. And then I also use pupillometry a lot. So pupillometry is, you shine a light in someone's eyes and your eyes they constrict and they dilate. But we have normative data in the MTBI population now that shows us what an average constriction rate is, what an average latency is, what a normal pupil size is. So we know if someone is more autonomically affected from their concussion than at their baseline as well. So yes, we use those pieces that there's debate around, but then I also use these other factors in my own clinic that they can't fake those. And a great example is, I had this situation happen, Dawn. Like I had a hockey player and we rehabbed him and he looked great and all his objective findings were on point. And then he got another concussion. And some of his findings still looked really good, but I popped him in my goggles,
right,
and they were not the same.
Right.
But
so sad. It's so sad that someone can work their entire life at their career like that and then just take one shot, and it's like this domino effect, it seems like. I mean, when you have one, are you that much more susceptible to have number two?
Again, it depends who you talk to.
Wow.
So there's some people saying that no, that's an absolute myth, that and I always think of it, have you recovered or are you compensated? So a recovery to me is when, the neural pathways are being used again, your brain is utilizing the systems as they should, it's processing sensory information properly. Balance is the easiest one to use an example for. So for you to balance, you use ultimately your visual system, your vestibular system, and your somatosensory system. So vestibular is that inner ear. It processes acceleration, both rotationally and linearly. It's your big gravity sensor as well. It lets you know if you're upright against gravity. We all know what vision is. And then somatosensory is that sensory information coming through. So when someone has balance, we know uses all three of those systems. So you say you get a concussion and your vestibular system, gets affected, but your visual system and your proprioceptive is really good, it can compensate for that poor functioning vestibular system. So you as a person might feel 100%. And objectively, like you might, depending on the testing that's done, your balance might still be pretty darn good because your other systems are compensating for this weaker system. So you take that person and you give them a second concussion, and potentially they are at higher risk because they already weren't in that optimal beginning state, right? Some people you talk to, they'll say, so if you recover and you rehab and you go through that process, you're not at risk. I just read a paper the other day that looked at youth between 13 and 20 years old, I think it was. And they said that those kids are at 4 times the chance of getting a second concussion if they've had a concussion.
Oh, wow.
So again, there's so much research coming out around concussion daily right now. I feel like that you're going to read both things. My big thing that I always tell people is if you get a concussion, go get an assessment. Go make sure things are on point. Go make sure, and that assessment can't just be a verbal discussion, right? We know a concussion can affect your visual system. We know it can affect your vestibular system. We know it can affect your autonomic nervous system. We know it can affect your emotions and anxiety and mood. So you need to have, and cognition. So that assessment should be a multimodal assessment that's looking at all the domains of what a concussion can affect. Go get that done. It's either going to show that you're great, which is awesome, move on, or it's going to highlight things that you need to improve on. So.
Yeah, like I think, Don, there's a huge connection between concussion and sports, say hockey, football, and soft tissue injury and ACL injury, those types of non-contact injuries. Because I think there's like you said, vestibular rates of contraction, to support a joint. So I think there's connections there when people are like, well, it's the turf, it's it's whatever. And the one question I had was in strength and conditioning, and Don can corroborate this, neck strengthening is always brought up. Like we got to strengthen the neck. And I don't know if it's true. I don't know if it's, I don't know what research has been done, but is that something you've looked at?
It's definitely something we look at. So the thought process behind, so there's not one thing we know that can prevent a concussion, but we're looking at it. And one of the areas that is getting researched is neck strength. Because we know that acceleration, deceleration, it's a whiplash-like injury, right? So a weaker the neck, the more severe potentially the whiplash is. So neck strength is absolutely something that's being researched as a preventative measure for concussion. And there's been some, there's one paper I read that compared vision training, neck strengthening, and I can't remember something else. And they said neck strengthening in at least a couple of the studies was showing some positive potential for sure. It's an area that clinically will absolutely pull into play. Again, just knowing the mechanism of how a concussion actually happens. And it's always part of the rehab of a concussion as well, always. Yeah.
It's fascinating. It's fascinating, and it's so obvious to you, especially, but to us as well. It's like it's fascinating how when you always hear, "Well, the mind affects the body." No, it does. It's like you don't understand. Like it's like this is what Derek just brought up. I mean, I've heard people mention it. I just wasn't sure if there was any concrete research out on it yet. Is there? I mean, is there any?
There is. So with the actual there is studies that show that the risk of musculoskeletal injury, so ACL, all those things, is higher after a concussion for sure. Yeah, there are definitely papers published with that.
And going through the actual sports, I mean, most people would think football, but statistically, do you know any of the stats on what you're most susceptible to getting a concussion playing, or is it like does the NFL have say 10% more concussions than the NHL? Like, are there stats out there on that?
I don't know if there's stats to that degree, and Canadian stats are going to be different than American stats as well. So one of the actual highest risks of concussion is falls, just falls in general. Right. So that's one of the things too is, I mean, people listening to this are very much in sport and healthy, but one of the big things is people think that concussions only happen to athletes, and they can happen to anybody. Right. So falls is one of the big ones. In Canada, football, rugby, and hockey are the other big three.
Right.
I even found when working with teams and athletes, women's soccer at a very high rate. And I don't know if it's because they're clunking heads together when they're trying to head the ball, or just even repetitive heading of the ball. And obviously, like you said, skiing, like Don was saying, gymnastics, cheerleading, I think is one of the biggest ones.
US cheerleading is a big one.
Yeah, I was shocked. Actually, did you, not to get off, it's not really off topic. Did you watch that series called Cheer?
I could barely watch it.
I don't even know what you're talking about.
There's I think is it a Netflix series?
I think it was,
Cheer? Yeah. It's 8 episodes, and it talks about one of the most well-known cheerleading colleges, and it's not like University of Texas. I forgot the name of the university, what it was called. It's on the tip of my tongue. It's gonna pop up in 1 second. Derek's probably looking it up as we speak. I could tell he is. But they literally, I mean, every week on this episode, someone was having oh my God, that person's dead. Oh my God, she just died. It's incredible. I've never seen athletes at any level put themselves under that type of risk. Oh God, what's it called? Eric, have you not looked it up yet?
I do remember cheer in the US is a big one. Cycling is another really big one.
What's it called?
So I say cheerleading is the big one in the US, and one of the other leading ones when you pull up the stats too is cycling, which is hilarious. Cycling. I'm looking at that. Which then people laugh because I have a 6-year-old son who races BMX, and so people are like, "Well, aren't you worried about your kid having a concussion?" I'm like, I can't bubble wrap my son. My son could get a concussion falling off the jungle gym at school, right? If he loves the sport, he has so much joy doing it. I am not going to prevent him from doing something he loves because I'm afraid he's going to get a concussion.
Well, that was my next, and I just looked it up. It's a university in Corsicana, Texas, and the university was called Navarro. No, I'm sorry, Navarro College. So I never even heard of Navarro until I saw this. But sorry, and I know that was completely irrelevant, but that was just stuck in my head, and I had to get out there. But yeah, and listen, unfortunately, my son's victim to it also, because he's been wanting to play football. And my wife and I are like, you can't play football, but you can play ice hockey, and you can go to the jungle gym and work on backflips and do all this other stuff, which is it's idiotic on our end. I don't know why we're like that. Should I just let go?
No, I'm kind of the same way though. Honestly, so I'm the oldest of 5 kids, and so it's 4 younger brothers, and they all played football. My dad's a football coach. My other brother's a football coach. My son won't play football. And it's because, there's more research coming out about the impact of repetitive subconcussive blows as well, right? So it's, again, there's a lot of research in, you know, how do we prevent a concussion? Okay. There's a lot of research in what's actually happening in our brain in concussion. And then there's research about what are the long-term neurological effects of having a concussion. And so there's research that's just starting to come out about, you know, what is happening to the people who have these repetitive subconcussive blows. They're not even having a concussion. And it's showing that these people are potentially more susceptible to depression and mental health things. If that's also coupled with like long-term loss of consciousness and other more significant concussions, then, you know, processing issues and things like that, I'm like, again, I don't think we can live in fear, but sorry for the people who I don't love watching football. And my son's 6, so I get to choose what he does.
I get it. We've just been kind of dismissive on it to the point where, like, you play hockey, you play baseball, you play all these other sports. No. Can I play flag football? Sure. But why do you want it? We're not going to let you play regular football. Derek's kids are exceptional athletes. And his son, I saw for years, was playing flag football. Has he transitioned to contact football?
Yeah, but we waited, you know, until he was 16.
Okay.
So now you don't have, like, I think what happens in a lot of the US schools is they start, Pop Warner, then they play, you know, high school, and then you get to college. And by the time you get to pros, you've been hit a lot of times and you've fallen a lot of times. So even with COVID, we were happy that he didn't have a season this fall, because it's like, okay, well,
kind of delayed it a little bit.
Yeah, we delayed it some more. So, but we're still working on skills, and that's why he liked flag, is you can still work on skills and not get that impact. So,
well, Natasha, I just really quick before we jump off of that, is there something to be said about that, where Derek was making a good decision because his son at 13, you know, he is not fully developed, is not fully formed, has not gone through puberty? Like, is there specific things, maybe neurologically, that you're kind of allowing things to happen naturally by removing that potential impact that could be causing, I don't know, maybe some issues to form a little bit quicker because he was getting hit at 13 opposed to 16? I mean, is there some truth to that? Because Derek, that's pretty smart. I never actually heard of someone saying that. I kept my kid out of football for a few more years because I wanted them to develop a little bit more physically.
Yeah, and it's potentially, like, we know our prefrontal cortex is not fully developed when we're at that age, right? And so then if you go cause an injury to something before you fully develop, then yeah, you potentially saved that, or kind of allowed for more of that development to happen. We know what we see a lot in kids with concussion. Kids take longer to heal. Normally, kids bounce back faster. That's not the case with concussion. We know that even if they're asymptomatic, their balance is still potentially having issues months later. And then the other thing that I did a podcast not too long ago, and I read a study about it after, but the amount of, there's higher potential of kids being diagnosed with ADD or ADHD after concussion, not the same type of ADD that we see that kids are born with that have that issue, but, you know, part of the issue and one of the side effects, let's say, of concussion is attentional issues.
Right.
And so when you think of a kid in school, there's a study that just came out about cognitive intolerance, and a huge percentage of kids have their grades drop after concussion. And so again, like, having a 13-year-old son or a 16-year-old son and not subjecting or exposing them to these things, are you helping them? Quite possibly. I mean, I can't say yes or no either way, but there is more research coming out about, you know, when our kids get concussions, we're sending them back to school too soon. Their grades are dropping. There's this ADD is getting diagnosed occasionally, and could be ADD, but is it attentional issues because of the concussion? We don't really know. It's a theory, but yeah.
Do you think, and I know Derek has a question right after, a very good question, but do you think that we should be delaying the age where kids start getting into full contact? Is that really, you know, if you look at it at the 0.01% of athletes who actually make it to that next level, you know, by turning around and saying, all right, you kids were allowed to hit at 12, you're now allowed to hit at 15, even in ice hockey, you know, by delaying that a little bit more, what's the downside?
That's a big controversial question. At least up here in hockey it is anyways. So there's two thought processes to it, right? So the thought process is when they teach these kids that are more, so hitting starts here. I just did a baseline testing for a hockey team that they were just starting their hitting, and they are, I think, 13. And the thought process is that because they used to hit younger than that too, right? So is that by still starting them when they're 13, you can teach them proper mechanics. You can teach them how to hit properly, how to take a hit properly, and they'll have less force, less speed because the kids aren't as huge. That's kind of one thought process on it. The other one is that then if you wait until they're 16, however it is, and then teach them to hit, they are like, kids aren't small, right? So then there's going to be a way more force behind the hit, way more power behind the hit when they're still learning how to do it. So, it's that catch-22 of, I think until we have solid research to say like these subconcussive hits do this, I think you're always going to run into this debate. I personally like the idea of delaying it a bit. Like I'm treating kids who are between 13 and 16 and on concussion number 2 or 3. Like that's.
I don't see, Derek, what's the downside? I'm trying to think about the downside. Like they're still developing skills. Like, is it worth it from an entertainment standpoint? Or is it where, no, these kids need to learn how to physically absorb a hit? That's a skill within itself. Is that why? But is it really necessary? Like, what do you think? Do you have another way of looking at it where, no, by removing hitting early on, you're doing them an injustice?
Um, in my opinion, and from my experience with my own kids, the level of coaching is not good enough to justify that at the lower levels. So then now you have to retool and reteach everybody how to coach properly. And I just don't think it can be done. So delaying it until they get to higher levels where the coaching is better makes more sense to me, because you go out there, you have a parent coaching the team. It's just not appropriate. Like, we're going to teach them hitting. These people don't know how to coach it. Let's be honest, right? So I think the longer you delay it and get them to the next level where somebody has been trained and coached to instruct in that, and I think maybe in New Zealand for rugby it's probably better, but certainly not where we are right now. So I think we have a long way to go.
Yeah, I don't know what the downside is on that. And Derek, I know Derek had I personally will go on record to say that I would prefer that hitting happen a little bit later. I just don't think it's worth it. It's not worth that one casualty. It's not worth that one 13-year-old who gets his bell rung or her bell rung more than once and now is having neurological issues and now is getting headaches at school and their grades are dropping. For what?
Well,
Like
and then
for like this sport is at that age, it's supposed to be about fun. It's supposed to be about exercise. It's supposed to be about developing movement qualities. It's supposed to be about team and camaraderie. And I don't believe personally, and I'm a physical person, I don't believe that by removing hitting, that you're taking away any of that from the athlete.
Well, and then when you think of, because I think a lot of people's minds jump to hockey when they talk about hitting too, right? And is the sport of hockey a hit, or is the sport of hockey the athleticism and the skill of maneuvering that puck through the ice and scoring, right? Like maybe it's because I'm me and I know what some of those hits do, but anytime I see a huge hit, and I'm just like, oh God.
Oh, it's painful. But we also saw it with fighting, where in hockey, and in, like one of my closest friends is the head of player safety in the NHL. His name's George Paros, and he was an enforcer in the league, Princeton grad, very smart guy. But he'll admit he's like, I got into the league, by fighting and protecting certain guys. And I'm like, and I was talking to him a while ago, I'm like, well, why? Well, why? It was such an entertaining part of the game. He's like, because they didn't want to waste, one player on the ice. They'd rather have a skilled player there than someone who might not have been as skilled. Not saying George wasn't skilled. He was a very good player, but I understand that. But the league got over that. They got over the bloodbaths and the games I used to go to back in the 80s with my parents and 90s of literally seeing Ty Domi, fighting in the in the stands, or Ken Baumgartner getting carried off the ice, bleeding everywhere, and a part of the game that you thought was so entertaining and so much fun, it's virtually 90% gone now. They got over it. Why can't we get over this with our kids, and why can't we protect them a little bit more?
Yeah. And I think, I don't know what it is too. It's, there's this, I think as a society, we're very reactive in nature. We're not very proactive. And so when you think of, people pay for personal trainers, they pay for exercise, no one thinks to get your brain looked at, right? Like, so for me, the big thing I look at is if we can, because we can strengthen your body and do all these things, obviously involves the brain too, but if you can come get an assessment done with someone who knows how to look at, like, say, these different domains, and we call it neural performance, but to look at these different domains, and you can find an area that you could strengthen, why wouldn't you do that before you got an injury?
I think a lot of us don't know about that. I think that's part of the problem. We always think of strengthening as strengthening our bodies physically. We don't really think about, how would you call it? Strengthening it neurologically?
Yeah. Well, and we just call it like neurological. I just think neurological performance, to be honest. And a lot of it can carry over, but it could be simple changes that you make in your routine. So example, your vestibular processes acceleration. So in your training, are you doing more functional or kind of linear training based on who you train with? But B, let's start to bring in more acceleration. If you're weaker to the right, your vestibular system processes more to the right. Let's make sure we do that. Like, let's bring that in. So you can work with, there's a team that I work with here that I did their baseline assessments and found commonalities amongst the team that could use improvements in some of their visual stuff and some of their vestibular stuff. And then we could work with that coach to say, here's some things you might want to consider bringing into your already practice. So not adding more in, but like tweak your practice to include a bit more of this type of saccade and then this type of movement, because then that's going to help train this part of their brain up a bit more. So it's not that you have to do this big other thing, but there's ways that we can incorporate, like it's called brain training or neural performance, into your routine already to help, from an athletic perspective, help these athletes have better performance. From a human perspective, it's going to help your overall better health.
Yeah, I wanted to kind of change lanes a bit. How much are you involved on the equipment side? And I'll tell a bit of a story here. Like, we shopped around for the best helmet for my son as well. And there's actually a company down in Seattle that was doing a really good job. It's called Vices, but they went out of business. They ran out of investment money, and I think one of the other helmet companies acquired them. So hopefully, that technology is incorporated. But how much do you look at helmets? And then on the recovery side, I have a lot of personal experience with electrical stimulation and transcranial. And even I know there's a local guy here doing like Pons device, tongue stimulation and all that. Yep. So those two areas I'm very interested in.
Yeah. So the helmet equipment side, I look at it, I'm not involved in it per se. No helmet has been shown to decrease risk of concussion. I mean, and that's what it comes down to. They're absolutely trying to figure out ways to do it. Same thing with mouth guards. They do not decrease your risk of concussion. And those are two of the biggest things you hear. Like, I have a great helmet. Fantastic. It's going to protect your skull. We need that. But nothing research-wise has been shown yet to truly, that we know 100% prevent or decrease concussion risk. In terms of the transcranial stimulation and the Pons stuff. So Pons is one particular company that does tongue stim. I use neuromodulation as well. It's part of in our assessment, we figure out, where do we need to stimulate or not. So we will do that in my clinic as well, depending on whether it's the tongue, whether it's, on the face, whether it's throughout the body. You had another question about treatment. Oh, TMS. I would love to see more research in TMS and brain injury. I would love it. I have one colleague that does do it in the United States, in Oregon, especially because it's that non-invasive. There's stuff that's showing that if you stimulate certain areas, it's actually helping facilitate new pathways in the nervous system. And then you couple TMS with rehab, because so TMS is the stimulatory piece. Now rehab it so that you can reinforce that stimulation and help create these new pathways. A lot of the research around TMS is around depression. But even that research shows, yes, you still get benefits with just TMS, but TMS coupled with therapy is even stronger. So I would love to see more in the TBI concussion world about that. It's something I'm very interested in, to kind of dig into more, and when a physical therapist is allowed to do it, because right now we wouldn't be allowed, or having that piece of it is something that I am keeping my eye on for sure. Yeah.
Dee, Oh, sorry, Derek. Did you have anything else?
No, no. I mean, I'm curious too with all of those technologies because I know like whether it's electrical or magnetic, there's a lot of work in the area of the brain. I think that are interesting because my mom had a stroke last April, and so we've been looking into that and doing some certain things with her, and I think it's been helping. So
There is a lot of TMS research around stroke in a
yeah,
positive way for sure.
yeah.
Yeah.
Can you talk about when you're saying online training? I mean, it would you know, early on we were discussing, and actually I don't even know if we were discussing this when we started recording, but you were mentioning about how your business is online and you're able to do a fair amount of online training. Is there a program that you have that someone listening to this can go to and they could start working on their brain like they would like to work on their body? Like, do you do offerings like that? And if you do, can you explain them to us a little bit?
So the online offerings that I currently do are for the main one is for people who have persistent concussion symptoms. So for those are those people that if you are 4 to 6 weeks out and you're still dealing with symptoms, then that would be what one of my kind of businesses is about. So it's called Concussion Compass. And what it is it's purely online. It's led by myself and my business partner, Molly Parker. So we're both physical therapists who've kind of focused our careers on concussion. And it is an education platform. And then we have some rehab exercises there and resources. So when you enter into that persistent stage of concussion rehab, usually it's either, someone hasn't been connected to the right provider yet. You're still trying to figure out, they're trying to figure out really what's going on. They need some guidance. They need some resources. So this program, it's a monthly membership program. So people can come in at any point that they need it. And there's self-assessments to help truly understand where they're struggling and what their deficit is. We call it a rehab at home program. So there's rehab exercises to help guide people. And we cover the foundational aspects of what PCS involves. So it's, we coach them on how to start to put aerobic exercise back into their day because that is so important in recovery. We talk to them about nutrition. We talk to them about sleep. We talk to them about dizziness, the neck, the vestibular system, visions coming out, how to deal with a sensitized nervous system. So it is so there's all these pre-recorded modules that they work through. But then we also do office hours. So what we call it is basically we sit in our Zoom room and we answer all their questions. So we do that twice a month. We do a mentorship call once a month. And then we invite like guest experts who are experts in concussion rehab into our community to speak with us on a topic surrounding concussion rehab in itself. So that's Compass. And then I personally do one-on-one coaching things as well. So yeah.
Sorry about that. Keep going.
So the one-on-one coaching I do is dependent on the person. So again, it's usually I'll coach for acute or persistent. The acute stage, when we talked about, that acute in this stage, you only rest for 48 to 72 hours. Then you need to start doing a gradual reintroduction to all of your activities, to exercise, to life. And then if we're not recovering properly, then you need to have some rehab assessment to see, do we need to pull in some vestibular rehab or some vision or whatever this is. So I do acute coaching packages where I'll work one-on-one with someone over a period of 6 weeks. And then I do persistent stuff as well, which is more of a 3-month, which is literally taking Concussion Compass, but making it one-on-one.
It's too bad that you can't establish, I don't know if you can or can't, but some sort of a prehabilitation program, like especially for the kids. Like and I don't know if there's any research pointing in the direction where it would actually help, but
that's on my list.
That's on your list. I just as you were talking, I was like, oh, how great would it be like if they're not going to change the hitting age to make the kids before they go out in the field to go through like a computer program for 5 minutes before every, like just something to sharpen them up, train their brain a little bit more like that, right? Is that what you're thinking about?
It is very much on my list. So there's a team locally that I work with, and I've already said to them, like, next year I want to put you through like a preseason camp. Awesome. And so but literally based on that neuro performance piece, and let's get everyone sharpened up. And then again, we can tailor, like, before you go out on the ice, here's what you do, like just get your system firing a bit more.
I love it. Derek, you have anything else? I think that was
even
fantastic.
Just having like if they can do an online baseline assessment so that's done, and then then when something does happen, you have that data to compare them against.
I already do that.
Yeah.
I can do that for anyone throughout BC and the Northwest Territories. So I can do an online assessment. And I have so that EQ Brain Performance, it is a live tool. So it's an app that's FDA approved in the US, supported by Health Canada. So we'll do a live assessment where I'll look at a couple different things here, but then they do this app and I get all the information. So I get a dashboard. So then they continue to do it. So it establishes, instead of doing a one-time snapshot of someone's baseline, it establishes more of a normative data for them, right? Because you have to figure it out. Like sleep's going to make you do worse one day. If you're super stressed, you're not going to perform as great. If you're on point and having an awesome day, you're going to do excellent. So it provides a neurological norm. And then there's a compare. So if anything happens, there's a comparison test. So they do a comparative test and I get the data right away. So what we do is we offer this baseline, and then you can have a program with us. So this is my other program that I always forget to mention. So we have another program with us that you'll do this baseline. We'll go through this assessment. I monitor you weekly. So you do your check-in. I can see where you're at. If for some reason, because there's just these stats out there that 5 out of 10 concussions actually go undiagnosed. If I start to see your stats dropping and your performance dropping, I'm going to phone you up and say, hey, what's going on?
Right.
Like, are things just crazy? And then if the person gets a concussion, they do a comparison test. I connect with you within 24 to 48 hours. We talk through what you need to be doing at that time frame, and then I'm going to help guide you out of that. So that is my other program.
Right. Seems awesome to me. Seems like every school and university needs to be doing something like this, right, Derek?
Yeah. Do it by team, do it by athletic department. But yeah, it should be done as part of, their medical, baseline test, right?
Is it getting better before we close out, and we tell everyone where to find you? Is it getting better or is it getting worse statistically?
The concussions themselves?
Yeah. Like, is it happening more frequently, or are we actually doing something about it right now?
I think we're seeing higher numbers because I think it's being caught.
Right.
Yeah, underreported.
I don't know if the actual numbers are changing, but the identification and diagnosis is improving for sure. Is the rehab improving? There's a long way to go there.
Right.
Yeah. There's more cases done because there's more testing.
Yeah. No, it makes perfect sense. Like I said, when I was younger, no one was blowing a whistle at it. They were like, oh, you have a concussion. Go home and sleep it off. Where can everyone find you?
The easiest way is Instagram, to be honest. So it's just at natasha.wilch. But there's also my website, which is natashawilch.com.
Derek and I will be posting this with that link to your social handle, and a way for people to kind of reach out if they have any questions, if they want to hear more about what it is you do. I think it's really impressive. I think it's very unique. And best of luck to you. I think this is awesome. I definitely would love to have you on in some time just to talk about the improvement when some groundbreaking things come through. Derek
Maybe test Dawn before hockey season.
Yeah. Well, there's no hitting anymore. What am I worried about?
Darn.
Just make sure that I don't start forgetting my name when we're on a conversation. I think I've been okay so far, Derek. But Natasha, if you need anything from us, let us know. Thank you so much. We'll send you the assets over if you want to throw up also in post. That'd be great. And again, if you're ever in New York, love to meet in person.
It's, again, never been. You know what? There was one time I almost went to New York and I ended up in Sparta, New Jersey, and never made it to New York.
A little bit different.
It's on our list too.
Not a knock to any of the Sparta, New Jerseyans, but a little bit different. But all right, D, thanks a lot. That was a great episode. Super psyched about that.
Yeah, your boy Ryan's in town apparently.
He is.
Yeah.
Yes, I can't tell you where he is, but he's got a quarantine right now. So, Natasha, thank you.
Thank you so much, guys. Have a great day.